Dr. William Loving, and I'm the Medical Director of Texas Star Recovery. I'm a psychiatrist and addiction medicine specialist. Since I'm a psychiatrist, we also do what they call dual diagnosis, or co-occurring disorders. We treat people who have mental disorders like bipolar illness and depression and anxiety and other psychiatric problems. If we don't treat the psychiatric problem and stabilize it, these people can't really get sober. They basically have two brain disorders, the psychiatric problem, and then they have the chemical dependency, and we specialize in treating both of those things. This treatment is truly a team approach. The team meets every morning at 8:30 to go over every patient so we all know we're thinking alike and working in the same direction. That this disease happens to perfectly good people. Learn that recovery is a great thing and that life really only gets better when they're in recovery. We do complicated detoxes from people that are on 2 and 3 different drugs, and we have a really good nursing staff that can do this safely and relatively painlessly. We don't think people need to suffer in their detox. We try to do it effectively and relatively quickly but safely. We emphasize using the 12-step programs a lot, and we help people learn how to use that in a way that can be effective. We also work with families because the families get injured by this disease too, and we try to have a family session with every patient. This is a brain disorder. It is a central nervous system disorder. Most people inherit something about their brain that makes them prone to addiction to the drugs that get you high. And we educate people about this as a chronic disease and a chronic problem. The treatment in recovery and the rehabilitation really works. There ought to be a lot of hope about this. If you get involved in the things we tell you to get involved in, and this treatment really works, so it's not a hopeless situation.